Rebecca.
Good afternoon. How are you?
Good. How are you?
Doing good.
Great. We're all set. I hit record. Now we wait.
Great. Thank you.
Mhm.
I see we have a few people joining us. Thanks for coming today. We'll be getting started here in just a moment. How are you doing, Dr. Gerard?
How are you?
Doing well.
Thank you for resending the link, of course.
Of course.
In a panic, lost it.
Of course. If you want to go ahead and pull your slides up, we'll go ahead and jump in. We do have some participants joining us now. So thank you everyone that's already signed on. If you want to go ahead and introduce yourselves in the chat, just scroll down to select everyone so that we can all see who's here joining us today. But we'll be getting started in just a moment. Thank you. Yep, I'm seeing your learning objective slide now. There we go. Okay, so it is 12:30 by my clock, so I'll go ahead and start the introductions. Again, welcome everyone. Thank you for joining. My name is Rebecca Farrow, and I'm part of the BHIPP team. I'll be introducing our presenter for today and facilitating our Q&A at the end of the session. Just a few housekeeping items. If you're attending today for CEU credit, you will need to stay for at least 45 minutes. If you'd like to receive either CME or CEU credit, you will need to complete the evaluation survey. This will be placed in the chat at the end of the session, but we'll also send it out over email for those that are in attendance today. CME and CEU certificates will be sent within 3 business days of survey completion. Following today's presentation, there will be time for questions. So when the time comes, please enter those into the chat. A recording for today's session, slides, and related resources will be available on our website later this week and also sent out via email. And then for those of you that are unfamiliar with BHIPP, we can advance a couple slides just to our, there we go. So Maryland Behavioral Health Integration in Pediatric Primary Care, or BHIPP, is a child psychiatry access program that supports the ability of pediatric primary care and emergency medicine professionals to address and manage mental health concerns. BHIPP is a free statewide program that offers telephone consultation, resource and referral networking, care coordination, telepsychiatry, telecounseling, and training and educational opportunities like this one. The BHIPP warm line is staffed by a team of child mental health specialists and is available Monday through Friday, 9 a.m. to 5 p.m. And our phone number and website will be placed in the chat for you. It is my pleasure to introduce today's BHIPP Resilience Break, Types of Mental Health Evaluations and When to Recommend Them, presented by Dr. Antonia Gerard. Dr. Gerard is an assistant professor and licensed psychologist within the Division of Child and Adolescent Psychiatry at the University of Maryland School of Medicine. She graduated from Nova Southeastern University in Fort Lauderdale, Florida in 2014 and completed her postdoctoral fellowship at Mount Washington Pediatric Hospital in Baltimore, Maryland. During her time there, following her fellowship, she developed an early intervention program and psychology's role within multidisciplinary pediatric clinics. She currently conducts psychological evaluations through the Center for Infant Study and Maryland BHIPP TAP program and supervises Healthy Steps specialists, early childhood experts embedded in pediatric primary care and family medicine practices. So we're very grateful to have you here today, Dr. Gerard. Thank you for sharing your expertise with us. With that, I'll hand it over to you.
Thank you, Rebecca, and thanks for having me here today. I'm going to just scroll through a couple more of these slides. So in terms of disclosures, I have no potential conflicts of interest. I am a faculty member at the University of Maryland School of Medicine. And the learning objectives for today are to determine when to refer patients for psychological evaluations, the different types of evaluations, and when to refer to each of those, and then how the results from those evaluations can inform treatment and school support. So I'll talk a little bit about our early intervention programs and IEPs and things like that. So in terms of evaluation referrals, I want to just touch on when we refer patients and what is helpful to do prior to and to determine whether a patient would benefit from additional resources or assessments or services. So surveillance or monitoring the patient's behavior and development, of course, should occur at all patient visits, and it's really helpful if providers can encourage caregivers to do this between visits. So just monitoring a child's development, and if there are any concerns related to social, emotional, and behavioral aspects of their development. And then, of course, screening itself should occur at regular intervals during their well-child visits, and based on the American Academy of Pediatrics guidelines, as well as anytime specific concerns are endorsed by caregivers or observed by providers when the patients come in for their appointments. And those screeners are often that first step to initiate referral for further services or more in-depth assessment. In giving screeners, it's important to remember that screeners don't diagnose a child just on its own. If a screener is positive, it doesn't necessarily mean that a child will receive a diagnosis, but the opposite can be true as well. If a screener is negative, but the family or you as a provider still have concerns, it would then be appropriate to refer for further evaluation. And then a full psychological evaluation can be administered to either confirm or rule out a diagnosis or just provide some diagnostic clarity about what's going on for the child. There are 3 different types of evaluations, and often the name of them are intermixed and kind of used interchangeably, and it can be very confusing for families to understand the difference, for providers to understand the difference, and quite frankly, even psychologists themselves sometimes to know the difference between the different types of evaluations. But it is important to know what each of them entails and when to refer for each, because we want to make sure that the patients are getting the services that they need and not having to spend extra time on wait lists for evaluations that may not be appropriate or may not give them the information that they need. So the 3 different types of evaluations include psychoeducational evaluations. These are done within the school system. They primarily focus on academic level or achievement, and often assess for intellectual disabilities or learning disabilities. And then psychological evaluations assess those same aspects that psychoeducational evaluations could assess, but also will more thoroughly assess for things like autism or other developmental disabilities. Will assess language skills, executive functioning, and then a range of behavioral and emotional concerns, mood disorders, personality disorders. And then the 3rd type of evaluation is the neuropsychological evaluation. And this is similar to psychological evaluations in that they also assess for things like executive functioning and language and IQ, but they do it from the aspect of how a child's skills are related to brain function. So to get more in depth into those 3 different types of evaluations and when to refer for which type, starting with psychoeducational evaluations, these are typically administered by school psychologists who either have a doctoral degree or a master's degree with a graduate certificate. This can vary by state and different requirements on what is needed to become a school psychologist. Typically, a measure includes a child's social history, intellectual abilities are assessed, basic academic skills are assessed, and then usually some kind of psychological screening is provided in terms of parent and caregiver forms, maybe some self-report forms for some older children. Now, in terms of the resulting diagnoses, testing results in an educational diagnosis. And I really want to highlight the difference between educational diagnoses and medical diagnoses, because the educational diagnoses are used to inform IEP coding and school accommodations, and have limited ability to qualify for things like SSI benefits. So if a family provides a psychoeducational report in order to receive supplemental security income benefits. The diagnosis must include either intellectual disability, learning disabilities, or borderline intellectual functioning. If there are any other diagnoses, but it's only coming from a psychoeducational report, it will not it will not qualify. And I also want to highlight that in a lot of cases, when a psychoeducational evaluation is conducted, it'll often say on the top psychological report, but not give any actual diagnoses. So they'll assess intelligence and or achievement, look at some other pieces, but depending on what the concerns are or the school psychologist credentials, they may or may not be able to provide an actual diagnosis. So again, it's helpful in informing the services for the child in the school, but may not be as beneficial for outside services, therapy services, or to qualify for additional supports outside of the school system. And then just to kind of talk a little bit about those disability codes for the IEP, when we are assessing, when children are receiving psychoeducational assessments, these are the different IEP codings that a child can receive in order to have supports in the school environment. The one that I want to highlight that I often talk to families about is the coding of developmental delay, especially if I'm assessing a child for an autism spectrum disorder or even an intellectual disability. If they receive that diagnosis from an evaluation, sometimes, especially in younger children, the school will say, well, we can code your IEP either as autism or developmental delay. And I always point out to families that developmental delay is a coding that children age out of at age 7. It goes through age 7. So by age 8, they would no longer qualify and have to be reassessed to see if they qualify for any other type of coding. So I just want to highlight that in terms of if that were to come up in your practices, that I always push for the more intensive coding, seemingly more intensive coding of like autism or intellectual disability, because it can follow the child throughout their schooling years and provide the most intensive supports possible. Because IEP procedures can be very challenging for families. Just the more supports we can get early on, the better. It's so much easier to remove supports no longer needed versus having to fight to add more down the road. And now for more information regarding psychological evaluations, these are administered by clinical psychologists, and typical measures include detailed developmental, medical, social, and psychological history, and then test batteries often have examine intellectual functioning, academic achievement, attention skills, and just executive functioning in general, language skills, visual spatial skills, and then also typically include standardized parent-teacher and, when appropriate, self-report measures to focus on the social, emotional, behavioral functioning as well. And these evaluations focus on a child's learning, behavior, mental health at home, school, and community settings. So a little bit different, where a psychoeducational report really focuses on the school environment. These evaluations take in all of the context in which the child is expected to function in. And these evaluations result in a medical diagnosis. This is required for SSI benefits for anything, including the ones that the psychoeducational reports will cover, but also any other diagnoses that allow families to receive benefits. The other thing that I want to highlight in terms of a diagnosis of autism specifically is, in order for insurance companies to cover ABA therapy, or that applied behavior analysis, they must have a medical diagnosis of autism to qualify. So Sometimes families have those psychoeducational reports that may or may not officially state that they have a diagnosis of autism, or if they do, they don't qualify as that medical diagnosis and being able to justify that ABA therapy is medically necessary and therefore allowing for insurance to cover it. So just want to highlight, if that's a concern that a family that you're seeing has, wanting to keep that in mind in terms of how we want them evaluated and by whom. And then the results of the evaluation also provides recommendations, not only for school accommodations, so they will discuss whether a child should have an IEP, but also what specific supports would be helpful in providing a successful learning environment for the child, and then any additional community-based supports that are needed. So in addition to, again, with the school, the psychoeducational reports can provide, they'll also provide a lot of recommendations in terms of, do they need therapy services? Do they need, speech and occupational therapy or physical therapy, or at least evaluations for those things to potentially receive even more services. And these evaluations, of course, can also help inform medication management if there are some questions about diagnostically what's going on for a child, and how we can tease apart some of the underlying concerns that are leading to whatever the presentation is in terms of informing medication treatment. And then finally, the neuropsychological evaluations are administered by neuropsychologists. Their typical measures include a detailed developmental, medical, social, and psychological history. And then they use really extensive batteries to examine intellectual functioning, academic achievement, executive functioning, language, visuospatial skills, memory, fine motor skills. And then they also have those standardized parent-teacher self-report measures when appropriate. So there certainly are components of neuropsych testing that overlaps with psychological testing, but these tests are even more so comprehensive and take longer to administer. So I would say on average, a psychological evaluation for a school-age child would be between maybe 3 and 4 hours. When I assess really young children, 2, 3, 4-year-olds, it's more like 2 hours, whereas neuropsychological evaluations can take all day. 8 hours or even more, sometimes depending on what the concerns are and the age of the child. Another highlight of the difference between these neuropsychological evaluations and psychological evaluations is that neuropsych evals can determine whether specific areas of the brain are responsible for current functioning. So, for example, after brain injuries. So this is something that a psychological evaluation isn't really able to tease apart. And these results also provide a medical diagnosis and provide recommendations for community-based supports and school accommodations similar to the psychological evaluations, and can also be helpful in informing medication management. So in terms of then going over the different types of evaluations, also then how does that help break down what type of, when to refer for which type of evaluation? So psychoeducational evaluations are appropriate when there are primarily academic or learning concerns, and when challenges are only occurring in the academic setting or in particular subjects. That's when a psychological evaluation can be, or a psychoeducational evaluation can be really helpful, and they're usually able to get that process started more quickly because the school has typical deadlines, which I'll get into in terms of IEP procedures, of when they have to conduct these evaluations. Psychological evaluations are recommended when the cause of problems are less clear, like the underlying cause, if a child presents with behavior problems, but we're not sure why there are these behavior problems, and we can look at, is there underlying anxiety, or are there other types of challenges in terms of expectations to function at a level higher than they're capable of? And then also anytime there's concerns across multiple settings, that's when a psychological evaluation can be helpful because they can assess how things are going in school, at home, within the community, or any other environment. And then the neuropsychological evaluations can assess for very similar diagnoses as psychological evaluations. But the main difference is that these evaluations are warranted when there's a known medical, genetic, or developmental condition, or there's some kind of suspected brain dysfunction. And the reason this is so important is insurance will typically not cover these evaluations if there isn't some sort of history of medical or genetic disorder. They are very thorough evaluations. A lot of times, neuropsychologists, between administering and scoring and gathering collateral information, are billing 16 hours for these evaluations. So insurance will only cover them when they really are deemed appropriate. So I can't even count the number of times that a family has been referred for a neuropsych evaluation by somebody, by various different providers, and there is no significant medical history that would warrant that level of evaluation. And if they're on a wait list to get the intake and then it's determined that insurance won't cover, they've wasted a lot of months where they actually were better suited for a different type of evaluation. Another thing to highlight, because neuropsychological testing can also look at things like psychotic disorders, and often are referred for patients that have more complex presentations, just making sure that patients are stable prior to getting this kind of evaluation. If they're actively psychotic, their cognitive and other skills and their functioning level may not adequately be assessed or demonstrate a valid picture of what their abilities are kind of across the board. So that's just something to highlight as well when we make referrals from more intensive inpatient services and they're stepping down and need evaluations to make sure that they're stable enough to endure those. Okay, so now I'm going to switch gears just a little bit and go into Maryland's Infants and Toddlers program and IEPs. I'm sure you all have come across this a lot with families needing services or needing referrals, and it can be quite a challenge and hurdle to get set up with these services at times, and just understanding what they all mean and what is available to families. So the Maryland Infants and Toddlers program is Part C of the IDEA, and it provides early intervention services to all children from birth to age 3 at no cost to the families, as long as they meet the eligibility requirements. And those eligibility requirements include a delay of 25% or more in development, or is considered to be developing in an atypical way in comparison to most same-age peers. And so this is the definition they provide. I'm not quite sure how, they do different assessments, but I'm not quite sure what that cutoff differentiation is. But if there are concerns, certainly worth erring on the side of caution to have a family or a child assessed to see if they meet criteria. Or if they have already a diagnosed condition that's likely to affect development, like a known genetic disorder or deafness, blindness, things like that. So referrals for infants and toddlers can be made by really anyone. The parents can make this referral, child care providers, primary care providers can make the referrals. As we know, families may have different levels of barriers that prevent them from being able to access these services directly. So as much as we as providers can help families connect with referrals to infants and toddlers, the more likely, hopefully, that they'll follow through with these services. So there are a couple of ways that these referrals can be made. There is a website, and let's see if it'll open for me. I'll just show it to you briefly. Let me know if you can't see this. So this is the website to make a referral for infants and toddlers. And there's this online system, and you can create an account, and it allows you to enter it online. There are also other ways to submit referrals, either via phone call and I think even email. And so this, let me open this other link here. This is actually a document created, and I believe Rebecca will add it to the chat for you all to have access to, but this is specifically a physician's guide to the infants and toddlers program. So a couple of things to note is the referral has to be made through the county in which the child lives. So the phone and fax numbers for each of them are available on here to know what number to call, and then also some of the reasons why we would make a referral to infants and toddlers. And then if it's something that you're wanting to fax in, there is the referral form attached here. And it just provides some information about how physicians can aid in referring patients to infants and toddlers, and kind of the next steps to expect, which I'll go into on the slides here. So that'll be available to you all as a resource. Let me just close these out. Here we go. I also put in here some of the deadlines for infants and toddlers because especially more recently, and I know this is very much related to the pandemic, and I'm sure infants and toddlers, like a lot of other places, are stretched thin in terms of being able to provide the services. But infants and toddlers has 45 days from the date of a referral to complete a functional child and family assessment, and then develop what we call an Individualized Family Service Plan, or an IFSP. So that, and I'll get into it, but that's the document that provides all of the supports that the child needs and the goals for treatment. So I shared this in the other document, but this is also another look at the different phone numbers and fax numbers for the various infants and toddlers contact by county. And then in terms of the IFSP, it's developed in response to an assessment that's done with the child and family present, and it is created by a multidisciplinary team. So caregivers are actively involved, service coordinators, and then the early intervention providers themselves. And it is required to include the child's strengths in addition to their needs, the priorities that the family is stating that they want to focus on. So whereas the providers might think, oh, X, Y, and Z is very important, they are required to take into consideration what the family is really wanting to focus on and what outcomes they want. And then they also have to indicate the timelines. So like a treatment plan of when these results are expected to be achieved and how that's going to be tracked and monitored for success. And then of course also listing the specific services that the child will receive, and I'll in a later slide have some of the specific services, but things like, are they requiring occupational therapy or speech therapy? And then, so there's 45 days from when a referral is put in to the assessment. And then once the assessment is completed and the IFSP document is created, they have 30 days to initiate the services that are outlined in the IFSP. And then it's reviewed every 6 months to see, is the child meeting their goals? If not, what do we need to change or add? And if so, what are the next steps? So these are the types of services that infants and toddlers are able to provide to families. This typically occurs in the home, so providers can come into the home, they can work with families in the community. With the pandemic, they had moved a lot of services to virtual. My understanding is that they're also occurring in the home to some extent, but still being offered quite a bit virtually. So and of course, I think that also depends on what the service is. So in the virtual world, of course, trying to have a child sit, a 2-year-old, sit in front of a screen and learn anything is not going to happen, but more so they're coaching parents on skills to then be able to utilize with their children. Infants and toddlers goes until a child turns 3. So the transition planning starts when a child is 2 years old, if they've been in services from earlier than that. And then at 3, there are 2 choices. They can either continue to receive services through the IPSP until they go into a more structured school program, so after their 4th birthday. Or they can transition to an IEP to receive school supports at the age of 3, where they can receive special education preschool services. So that's something that's discussed with the infants and toddlers team, but also providers can certainly help support and provide input based on their knowledge and expertise to help inform families on what decision might be best. So then the IEP is a document that contains the student's current level of academic achievement and functional performance, also the statewide assessments that the student will participate in, so those tests that they take annually at school, any special considerations like a BIP or a behavior intervention plan, which is a plan designed to address specifically problem behaviors exhibited by a student in the school setting through the use of different types of positive behavioral interventions and different strategies and supports. These are created usually following a functional behavioral assessment or an FBA. Which is a systematic process of gathering information to guide the development of an efficient behavior plan for whatever the problem behaviors may be, and often looks at like the functions of the behaviors and in terms of being able to determine how any behavior challenges can be reduced in the school environment. Let's see, and then they also can provide assistive technology where appropriate, and special instruction, any kind of program modifications and supports. So some of the supplementary aids could be like electronic communication devices, preferential seating in the classroom, being able to use a calculator, receiving peer tutoring. And then some of the program modifications and support examples would be like adapted assignments, specialized classroom seating, modifications to testing environment or structure, physical modifications to the classroom, or receiving additional individual assistance. And then Child Find is the special education service which identifies children from the age of 3 to 21, so after the age out of infants and toddlers, suspected of having an educational disability, and then who may be eligible for special education services. So when a family is identified as potentially benefiting from their child having an IEP in school, we recommend them contact Child Find, who will then start the process of having IEP meetings and gathering any data and information and assessments needed to create an IEP or see if an IEP is warranted. So the steps to developing an IEP, similar to infants and toddlers, starts with a referral. This can also be made by a variety of different providers, including primary care providers, the caregiver themselves, other teachers, social workers. And then they do their own assessment to see if the student has a disability and therefore requires special education. So this can be done through a psychoeducational evaluation. This can be done by providing, if they've already received a psychological or neuropsychological evaluation, oftentimes the school will accept that. There are times when they decide they don't agree with whatever the diagnoses are and want to do their own kind of assessment, but oftentimes they will accept those outside documents. And then they'll determine if a child is eligible by having an initial IEP meeting, and it must happen within 60 days of the caregiver giving consent for testing to determine, what kind of supports the child would need. And a couple of other things to highlight is that reevaluations are required to occur if the child with the disability continues to have, the disability, to make sure that that they're receiving the level of supports that are warranted in order to make academic progress. And whether there are any kind of additional modifications or more intensive special education services that are required, or whether they still need the services or have made so much progress that it's no longer warranted. And then a reevaluation may or may not require new tests. So they may just kind of come together as a team, review everything, and go from there. Or if it's been 3 years, they're required to do a reevaluation at least once every 3 years. Or if the teacher requests new tests, if there are concerns maybe that there are additional things going on and feel like more testing would be warranted. And also, before the IEP or the IEP team can determine that your child no longer needs special education services, they would also need to evaluate to confirm that that is in fact the case. Now, this is something that comes up a lot with parents when they're asking the school to do testing, and the school is saying that, no, we can't do it, we're not going to do it, it's not warranted. So a school's not required to give new individualized tests unless you ask specifically for new tests. Before a child graduates from high school with a regular high school diploma, or if they're no longer eligible for special education services, the school does not have to do testing in those situations. So in terms of the process of establishing the IEP, there are a lot of different steps and requirements and timelines to getting everything set up. So the draft of the IEP must be given to the family at least 5 days prior to an IEP team meeting to give them time to review the IEP. Sometimes families will have educational advocates or just other providers that have a good understanding of the school system to be able to provide information, supports, direction. And then the IEP team meeting includes the caregivers, their general education teacher, special education teachers as necessary, public agency representatives, and then the student when it's appropriate to have the student's input based on age and cognitive presentation. And parents must receive proper written notice of an IEP meeting in terms of when it's going to occur, where, why they're having the meeting, and all of the people that will be present at the meeting at least 10 days prior to the schedule. So this is the front page of the IEP. I don't know how many IEPs you all have come across, but if you have, I assume that it can feel a little bit like a beast to go through. There's a ton of information. It can be hard to find things. It can be challenging to navigate. There are online through the Maryland, through I guess the Maryland Public School website, copies of blank IEPs that can kind of help orient to what you're looking at. But a couple things that I want to highlight is I always like to know what the IEP is coded for. That's something that if a parent endorses that a child has an IEP during like an intake appointment, I want to know what it's coded for, because that can help in terms of what kind of supports are warranted and what diagnoses they may have. And a lot of times families may not know what that is or where to find it. So I'll highlight that here, but that primary disability is where that would be. So this is the coding that I mentioned earlier in this section on psychoeducational evaluations, where it's used to determine how to code an IEP, and it can be under like developmental delay or autism or intellectual functioning or other kinds of disabilities. This is where it's located on the IEP to reflect what the IEP team ultimately decided was appropriate. And then similar to the infants and toddlers program, where they're split up by county to be able to contact. This is the child find contact list by county to contact to make referrals for IEPs. And that is it for me.
Wonderful. Thank you so much, Dr. Gerard. So we'll be going into our question and answer portion. If participants could enter any questions either in the chat or the Q&A box, whichever is easier for you. But we do have a few questions we'd like your thoughts on to start us out. So it's kind of just a general question. How might you prepare parents when their child is having an evaluation?
That's a great question. Depending on the parents, what the concerns are, it can be more or less even more important to prepare a family. So being able to describe kind of what the testing is for, or what will be occurring in terms of looking at things like their cognitive skills and social, emotional, behavioral functioning, if warranted, or if academics are concerned. So letting them know what the evaluation will likely entail. And the type of provider that's giving the evaluation, whether it be a psychologist or some other type of clinician. And then the biggest thing I would say is preparing the parents for what is being assessed for, what the referral is for. So I do a lot of testing for autism. And there have been numerous times that a family gets to me and they are blindsided that the evaluation is for autism. They had no idea. Or for intellectual disability or something like that. Some of those heavier diagnoses, and being able to prepare them by doing screeners, doing the MChat or some other kind of screener to show them like, wow, okay, you're showing that there are some concerns here. I think this would be really nice to look at, because these are some things that we tend to see in children that have a diagnosis of X. Can be really helpful for families, so that by the time they get to us for testing, it's not the first time they're hearing about it. So they hopefully are more open and willing to receive the information to get their child the help that they need.
Sure, that's great. So kind of in line with that, how do you support families that are surprised or upset by maybe the reason for the referral or the results of the evaluation?
Parents can be upset for a number of reasons. Of course, it being a shocking diagnosis, it's depending on what the diagnosis is for a family, it can feel like a loss of the child that they thought they were going to be raising. The idea of when they had this child, and just the expectations for this child growing up, and for that to change can be very, very hard for families. So oftentimes what I'll say to parents is, this child is the same child that they were prior to this evaluation. Now we have a name for what's going on for this child to be able to provide supports to make them as successful as possible. So, understanding where the family's coming from in terms of their concerns with the diagnosis. Now, if they don't agree with the diagnosis, it can be helpful to ask for a copy of the report, kind of look through some of the different pieces, depending on your comfort level, with the test and interpreting to help the family understand or provide even more psychoeducation, or even trying to connect with the provider who did the testing to be able to kind of bring everyone on the same page can be very helpful. And then sometimes, you get to a point with a family where they really don't agree or in significant denial and want like a second opinion, and that certainly is fine. But if the testing seems reliable and appropriate and the diagnoses are warranted, we also want to make sure that the family's getting the services. So as much as providing support, but making sure all of the different providers on the child's team are able to send the same message to the family to help them with their child getting what they need.
Thank you. So another question here in the chat, are IEP evaluations done through the summer? And if not, should we refer kids that are struggling at the end of the school year so they get in line for eval?
That is a great question. I do not believe they do IEPs in the summer. There is a chance that may not be the case across the board. But typically during the school year is the best time to get them set up to have an IEP done. Usually at the beginning of the school year is when everyone wants all the things. That's when testing wait lists get longer, because kids are getting back in school. These concerns are arising after having a long break from any kind of structured learning or requirements. So anytime that IEPs can be requested throughout the school year, but definitely not during the summer, even as much as it can be done prior to the beginning of a school year, can certainly help the process go a little bit smoother and set them up, for the next school year.
Right. And a follow-up question to that. This provider says, I always did IEP requests through the school and the student needed a letter from the physician requesting eval. Is it preferable to do the IEP referral through Child Find? Would that get around this letter requirement?
I don't know that I necessarily heard that a letter was required. That seems like definitely an extra hoop to jump through. Because any kind of provider can make the referral, and a parent can even make the request themselves. It seems like they're just adding another layer of work for you. That shouldn't be a requirement. So even if so sometimes families will contact the school directly to start the process. But Child Find, I think, can be helpful if you're finding, especially if you're finding yourself with a family whose school is making it challenging to get the services needed, because they have these requirements and certain procedures to follow. And while we would really like to say that's the case across different school districts and specific schools, it's unfortunately not. So Child Find can certainly be helpful in making that process more smooth.
So building off of something that you had just mentioned, I was wondering if you have any resources or suggestions specific to Maryland for families that are, there's an IEP in place and maybe the school system isn't necessarily following through on the accommodations that are agreed upon in that IEP. Are there any organizations they should reach out to for these kind of concerns?
Yes. I can pass along to Rebecca a list of educational advocates that I often provide to families. They know the ins and outs of of how to navigate IEPs in schools and what's allowed and what's not, and can help parents advocate for themselves, even know what to request and advocate for. So that's definitely come up a ton and can be very helpful for families in navigating when the needs aren't being met, or and that's also another case where if perhaps but if a psychoeducational evaluation has occurred, that maybe then getting an outside evaluation could be helpful to help support the needs of the child. And then sometimes too, you end up with the struggle of the school deciding they don't want to take the outside report. And that's when we really want to get educational advocates involved. So these we often provide to families that may not have the financial resources to pay for a private advocate to work with them. So this can be really helpful for any kind of populations that you all might work with. So I'll pass that along to send out.
Wonderful. Yeah, I'll include that in the resources that we send out. And just a couple follow-up comments on the issue with the letter being required. We have a participant saying child psychiatry, I don't think letter is required either. And then Charles County is the school system that has required many hours of letter writing. So not sure if it's specific to that county.
That is a good question. If that, even just contacting, I think, Child Find directly and asking, because I'm not very familiar with that county, if that is for some reason some kind of requirement, or sometimes we also find that schools feel like something is a requirement because they've always done it that way, and it's not necessarily the case. So certainly worth verifying through Child Find if that's actually some unique requirement to that county specifically. That's a lot of work if it's not required.
Yeah, definitely. So we still do have a few minutes left for questions. You can go ahead and put those in the chat. Just another couple general questions, and you kind of touched on this a little bit, but more broadly, how long are evaluation results accurate for, or how often should the different types of evaluations be completed?
So it depends on what the diagnoses are and whether families have continued concerns or have noted a lot of progress and want reevaluation. So I will say the minimum wait time is typically a year before getting a reevaluation, because of course everything is kind of dictated by insurance companies. Insurance will not cover a new evaluation within a year, unless you can make the case that it's assessing for something that wasn't assessed in the previous evaluation and there is medical necessity behind it. Also, validity of certain test measures, they can only be given every 6 months or so, even though there usually are multiple different versions of or types of tests that can be used to circumvent that. In terms of then when a family should be reevaluated, part of it can be based on age. So if we're seeing, 2, 3-year-olds with global developmental delays, a lot of, language delays, maybe receiving a diagnosis of autism, we usually want to see them in a couple of years once they've had services in place and they're getting old enough to have more of a can qualify more for IQ testing, and whether they meet criteria for like an intellectual disability versus that global developmental delay. And then for older children, we usually recommend testing within 1 to 2 years, again, to monitor progress. If things are going really well, they're in, therapy services or have received other interventions and there's not a lot of concern, it's certainly not a requirement. Or if parents note pretty significant new behaviors or concerns that come up, they don't have to wait 2 years for that to be addressed. But I would say on average, we usually recommend every couple of years. Now, for things like autism evaluations to qualify for ABA, oftentimes, if a child was diagnosed with autism 3 years ago or more, and the family is now pursuing ABA therapy, they'll require a reevaluation. And then sometimes insurance, depending on what insurance company it is, they'll require a reevaluation to see if the child still has autism every like 6 months. And usually that can be pretty quick because, as we know, this is considered a lifelong disability, but another hoop to jump through for insurance companies. So, very long-winded answer to say it really just depends on what the concerns are.
Sure. And I think that might be the answer to this next question, but if you could speak to, are there any appropriate ages or cutoffs for the different types of evaluations?
For psychological and neuropsychological evaluations, there's no cutoff. There are tests that are normed starting at birth. I mean, typically we don't see children that young, but I've seen children as young as 15 months that are showing signs of autism or just global delays, and families are wanting assessments to inform what other types of services would be helpful. And neuropsychology can do the same if there are, if there's a genetic diagnosis or something else going on, where they can do an assessment and then better be able to monitor their functioning. For the psychoeducational reports, of course, starting once they hit school age. So once an IEP is being developed, so that could be at 3 once they age out, or older. So that's the only one that has kind of a minimum. And same for, of course, once they leave school, no longer getting educational evaluations, but adults can receive testing, if they're for any concern, if they feel like they were never diagnosed with, or feel like there are concerns for a personality disorder or something like that, that we only diagnose in adults. So the whole age range can be assessed, or if they're like cognitive decline, as adults age and needing neuropsych assessments for that too.
Okay, great. Well, thank you. I'm not seeing any other questions as of right now. I went ahead and put the evaluation link in the chat, so please do complete that if you're looking for CME or CEU credit for today, but we do appreciate any feedback. So thank you. We will also put our information about our social media accounts. Please do share anything that you've learned from today, or just follow us there so that you can see about our upcoming webinars. And we just really appreciate your time today. So thank you again, Dr. Gerard. Do you have any closing comments or thoughts you'd like to leave us with today?
I don't think so. Just feel free to reach out to me if you have any other questions to follow up this presentation. I'm always happy to answer.
Wonderful. Thank you so much. And again, those CME and CEU certificates will be sent out within 3 business days of survey completion. We'll also have a recording of today's presentation, the slides and related resources on our website later this week and sent out via email. So thank you all, and I hope you have a wonderful day.
Thank you.